Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
It's Lindsay Smith-Rogers. Today, a look at the overall state of vaccine support in the U.S. Michael Osterholm is one of the founding members of the Vaccine Integrity Project, an initiative by the Center for Infectious Disease Research and Policy at the University of Minnesota to safeguard vaccine access by elevating scientific evidence. He joined Stephanie Desmond to talk about his work to combat misinformation around vaccine safety and effectiveness, and he unpacks the most recent meeting of the CDC's Advisory Committee on Immunization Practices. Let's listen. Mike Osterholm, thanks so much for joining me.
Well, thank you for having me.
I wanted to talk to you today about vaccines, and I know that's a huge topic that you spend a lot of time on. But just as a citizen in this country and the last few weeks, I feel like knowing that vaccines are one of the greatest advances ever made in public health, that trust is falling so low that it's hard to know where to go for good information anymore. What's going on?
Well, I think, first of all, we want to put this into some perspective. I agree 100% with you. This has been by far one of the greatest advances in public health in the history of humankind. Probably the only other thing that is more significant or of some significance was the fact of providing fresh water, sewage treatment plants, etc., helping to eliminate many of the enteric diseases that we worried about. But as far as if you look at just the last century alone, the millions and millions of lives that have been saved because of vaccines, even counting in the early part of the 20th century smallpox, which killed almost 300 million people in the 20th century, and it was only here for the first years of that 20th century. So it really is a remarkable achievement to look at vaccines. Now, if you listen to what's happening out there, you have to acknowledge that our vaccine enterprise is at risk. It clearly is at risk. But I'm also encouraged by the fact that surveys that have been done recently show that still up to 90% of the public across the board still believes in vaccines and supports vaccines. The challenge is that they're finding it harder and harder to get reliable information that can help them make that determination for themselves and can confirm for them that they're doing the right thing by getting their children vaccinated. And so I think that we have to be very careful not to say the sky is completely falling, even though it's very challenging, and at the same time capitalize on those that do believe that vaccines are important and how can we continue to support them while at the same time we're dealing with this mis and disinformation.
And this right now is coming directly from the leaders of our health agencies. Isn't that right?
It is, and this is one of the challenges. On the night of the election, I realized when Mr. Trump had won, I went and pulled out the 2025 document and to look at it to say, okay, what does this mean? What is in this document around public health? And when you look at the issues around vaccines, we should not have been surprised at all that what we're seeing now is happening. In addition, Mr. Kennedy was named early on as a major supporter of the campaign, and that is very likely he would be at least nominated for Secretary of Health and Human Services. And knowing how he had over the years handled the issue of vaccines, loaded with mis and disinformation, it wasn't a surprise. I actually wrote an op-ed piece in the New York Times in November, not long after the election, and said, wake up, everybody. This man's going to take your vaccines away from you, and this is what it means. And I think there was a general sense, oh, it can't be that bad. It can't be. You're crying here when you don't need to be. Well, I think we've all realized, no, it was that bad and more. What we see right now is a system of public health that can't be trusted, which is very hard for me to say. It's like a fishbone going down crooked. What do I mean? Right now, the entire senior leadership at CDC and the executive suite are all political appointees. Not one senior scientist from the agency is there. What kind of organization is that to be prepared to respond? And then we look at the number of people who are gone, who are no longer working there. Again, major cuts to vital and critical programs. So right there, you have a challenge. You have a challenge of state and local health departments right now with, because of cuts happening, similar pictures of loss of capacity. And so I think it's really important to understand this is a very, very challenging time. And what we have to do is be able to address the mis and disinformation. Well, you think about what happened last week with the ACIP, the Advisory for Immunization Practices, at the end of Thursday's meeting, as they took a very confusing vote that they had to come back Friday and redo because it was so confusing, one of the members actually said in a hot mic, "What did we just vote for just now?" Does that give you any confidence in this group at all? And so one of the challenges we have right now is how do we find alternative sources of information that we can count on, that we can believe in? And at least until we can only hope one day that CDC is restored to its previous prominence in science excellence and that ACIP likewise is restored.
So I have been following the news, and I have a pretty simple question, I think, for you, which is I'm a 50-something woman. Can I get a COVID vaccine?
Well, a good question. Technically, yes, and technically, no. It depends on what state you're in, first of all. And let me just point out that any comment I make about this today is subject to change. Why? Because all the votes that were taken by the ACIP last week have to then get presented to the acting director of the CDC, who, with the Secretary of Health and Human Services, will decide, do I accept that vote or not? And one of the votes that came up around COVID vaccines would it be required to have a prescription to get a vaccination, particularly for those under age 65. And it was a question that came to a tie vote. And because the chair had voted to not require that, that's the decision. I wouldn't be surprised if in the next few days we hear from the secretary or the CDC acting director that they've decided not to accept that. They are going to require prescriptions. So now the answer to your question becomes, if that happens, what's your access to health care to get in and get a prescription? And particularly when there are many of us that want to get that. We already have tremendous challenges with access to health care. And so the idea that someone has a private physician that they can just call up on the phone and get something taken care of like that is ridiculous. So I think this really follows the rule that I often recite is that vaccines are good, but vaccination is what is great. And so that we're going to have to figure out what are the barriers right now that these new ACIP requirements and specifically how those votes may be taken, how will they play out and what does that mean for our access?
One thing that struck me was that certain groups of Americans can get the COVID vaccine, but it's going to come with some misinformation on the side.
All of the COVID vaccines administered are supposed to have this new information, which actually is not factually based about safety issues. Let's give an example. Early on in the pandemic, when we had vaccines spaced only a limited number of 2 weeks, we did see myocarditis cases show up, particularly in adolescent boys and to young men. They were across the board mild cases. No one died from that myocarditis associated with the vaccine. In many cases, individuals were hospitalized only a day or two. And it was very different than if you got myocarditis as a result of the actual infection. There, we did see fatal cases, and we also saw a situation where people were ill for quite some time. Now, if you had to take a risk assessment here, you'd say, is it worth this to get that? Meaning, I have minimal risk here for something versus maximal risk over here. That's reasonable. But what's most interesting is since we spaced out the vaccines now, and there's this prior immunity, we're not aware of any recorded cases of myocarditis associated with this vaccine in recent years. None. And so now the question becomes, does that become a point of discussion between a healthcare provider and the patient? Oh, you must know about this risk of myocarditis. How many of them are going to be prepared to discuss it like I just did, where I happen to know the inside line of what happened, and where I would say to someone, this risk just doesn't really appear to be at all operable to today, so you don't really need to consider that one. And I think that's the challenge we have right now is that if you put enough unknowns that sound scary on top of someone's approval to get vaccine, why would I want to get it? Maybe I'll just wait. I don't know if this is safe or not. And that's what this group is trying to do, obscure the truth by basically putting this information forward that is not true. that, in fact, has been refuted by the experts in this area. That's a real challenge.
And that's going to be included as information when you get a vaccine.
It will be now, and theoretically, your healthcare provider is supposed to review it with you. Now, I mean, how many people have 15 or 20 minutes to go through a vaccine background for a prescription that at this point is meaningless in terms of what it really protects you from?
And this is kind of where your vaccine integrity project comes in. So could you tell us a little bit about what that is and what the goal is?
Well, as I noted a moment ago, I saw literally the day after the election that we were going to be in big trouble with vaccine enterprise integrity going forward. And so I followed it after the inauguration and the nomination of Mr. Kennedy and what was going on. I began to realize and say, you know what? We're soon going to see ACIP basically gutted. We asked ourselves the question, what could any other organization, realizing as a non-governmental agency, academic group, whatever, what could we do to help fill in if ACIP loses all credibility? What would happen if CDC does? Where would be trusted sources of information? So at that point, we met with Christy Walton and her foundation and said, could you help us get this started? Let us first do a series of focus groups, 6 focus groups involving the entire vaccine enterprise system, and ask them what they see the problems are, what will be the challenges if ACIP and CDC do not actually be able to perform their functions. We had 6 focus group meetings, again, involving everyone through the entire system. And we identified 8 different areas where there were going to be major deficits of activity or valid information forthcoming, and that others, if they could fill in and help with that. We chose specifically 3 areas out of those 8. And I had a steering committee that helped us come to the conclusion these are the 3 we ought to concentrate on. And first and foremost was the one to actually provide the kind of review data, the protocol-based review data that ACIP was so well known for in the past that would be used to make decisions about what should the recommendations be. And so while we clearly are not a governmental agency, or nor we ever hope to be one, we could only do one limited amount of that because we wouldn't have access to the government-held data, or would we have access to the company data. But we brought together 26 individuals from around the country, experts in infectious diseases, study design, protocol review, etc. And we looked at, for the fall vaccine season, which we're in right now, notably for influenza, RSV, and for COVID, and we actually then launched on these protocol studies. We identified 1,750 plus abstracts of information that had been generated since the last time the ACIP looked at these 3 vaccines. So we went back as far as ACIP had last addressed them. We then went forward with our review and accumulated the information specifically on high risk or groups of interest or importance, such as pregnant women, children, etc. And we have then worked those data to the point of drawing conclusions that we could then share with the medical societies, which in the past, as you know, did actually also make recommendations based largely on what ACIP provided. And so, for example, we were helpful to the American Academy of Pediatrics in terms of how they made their recommendations. We surely did not pretend to be ACIP. We made it clear this is what we had, this is how we did it. We had a public open meeting where we presented our data to a panel of experts, including the editor of the New England Journal of Medicine, and had that review done so that that information could be handed to the societies. We're now currently looking at additional vaccine evaluations and protocol review, so we also can help provide that. The second area that we picked was that of mis and disinformation, and we're right now in a situation where we're working with several other outside parties, and we are actually coming together as a group to come up with what can we provide that will be most helpful in terms of responding to mis and disinformation. You saw it firsthand last week with the ACIP meeting, and so how we address that. And so we're working on that one right now to put together a system. And then finally, we're just looking at, is there any way we can help in terms of coordination? Not us to do it, much like the vaccine issue. We did not pretend to be ACIP. We did not pretend to make recommendations, but we did all the backroom work, you might say, to actually come up with the data to support vaccine recommendation. And so we're looking at a cooperation model also of can we help? Because there are a number of parties out here who all have intense interest in this, who are doing some work in one way or another with vaccines. And the question is, what is it that they could do in coordination?
How do you cut through the noise right now? How do you cut through with the information that you know that you have evidence for?
Well, you just have to keep putting it out there, and you have to keep hitting head-to-head with the dis and misinformation. It's not easy. Sometimes it's not highly effective, but we have no choice. I mean, I keep reminding people that this whole effort here is really about our kids and grandkids. And we need to be very clear that what we're doing is providing the same information that we have provided over the years that brought us to the point of just a few years ago of being measles-free, of seeing childhood illnesses at an all-time low, not only in high-income countries, but even in increasing effectiveness of vaccines in middle and low-income countries. How have we backslid so badly? And so I think we just have to come back to that and know that we won't be perfect. It's not going to be easy, but that failure is not an option here because it is about our kids and grandkids.
I'm curious also the entire vaccine infrastructure. The skepticism, if it becomes more mainstream, could really impact that, could it not?
It actually could. But I want to remind you that, as I said at the opening, there still is a tremendous amount of support for vaccines in many circles around this country. And we have to capitalize on that and understand that we still have made major inroads. But we are at the risk of losing some of that, and that means more infections, more illnesses, and that will spill over to even those who are vaccinated. I wish measles vaccine was 100% effective. It's not. Maybe 95, 97, which is incredibly good. It's amazing, but it's not perfect. We have children today with immune-compromised conditions. Their vaccines may not perform at the same level as those of a healthy child. Again, we have to keep mindful of that and why we want to have the whole community vaccinated. So I think it's a function of just keeping our priorities straight. So in my office here, I actually have on my desk a gift from my daughter a few years ago, which is an electronic picture frame. And every 30 seconds, a new shot of one of my grandkids, or I have 6 of them, comes through here. And I can tell you right now, if I ever needed motivation to do what I do, all I have to do is in a busy meeting, take a look at the picture frame, and I understand why I'm doing what I'm doing.
Mike Osterholm, thank you so much for joining me.
Thank you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.